We're quickly trying to move to what is now the sacral neuromodulation. Okay. So it's kind of like a surgical approach, okay, to treating all those urinary bladder stuff. Okay. Neuromodulation. Of course, when you hear modulation, they are trying to keep something in check. Okay. So sacral neuromodulation, of course, like is an implant. So the implant is what is now sending some 1 or 2 waves that will control the sacral nerves. Of course, the sacral nerves come to the bladder. Do you understand? So let's talk about it. So it's a minimal invasive therapy. It uses electrical stimulation of sacral nerves to treat bladder issues. You can also use it in treating bowel issues. But this one you can likely see that is for bladder stops. This one too is for bladder. Okay, bowel stops should be, redirected to the abdomen. So how does it work? It actually targets the sacral nerves, particularly S3. Okay, so S3 plays a very important role in bladder and bowel and pelvic floor muscles control to check to initiate when they will contract or relax. So a small device as a pacemaker is implanted under the skin, typically in the upper buttocks, right? So the device sends mild electrical signals to the sacral nerve via a lead wire, okay, helping to restore normal communication between the brain and the pelvic organs. It will stimulate it if the communication is fading out. Okay, so it modulates spinal reflexes involved in bladder and bowel control, influence brain networks responsible for continence through afferent nerve pathways. So possibly exert motor effects via the efferent stimulation, enhances sphincter tone and detrusor inhibition. Okay, so it's used for treating urinary incontinence. Okay, if your bladder is overactive, that's detrusor instability, non-obstructive urinary incontinence, fecal incontinence too, also neurogenic bladder dysfunction. Okay, so just an introduction to this. Okay, that's basically the functions.